Manual muscle test supinator. The origin of the supinator is the lateral epicondyle of the humerus. The insertion of the supinator is the proximal 1/3 of the radius, and the action is supination of the forearm. This occurs in the transverse plane across the longitudinal axis. Instruct the partner to hold out their wrist, bending at the elbow, and supinate their forearm so their palm is facing upwards. Supporting at the elbow, I'm going to grab their hand and pull them into forearm pronation as they resist. The partner is able to resist and gets a grade 5. Manual muscle test tibialis anterior. The origin is the superior tibia. The insertion is the medial cuneiform and the first metatarsal. The action is ankle dorsiflexion and inversion. The plane of motion is the sagittal plane and the frontal plane for dorsiflexion and inversion, and the axis is the anteroposterior and the mediolateral axis. Have the partner sitting with their ankle hanging off the table. They are going to perform ankle dorsiflexion and inversion. Supporting at the ankle, I'm going to pull them into plantar flexion and eversion, and they are able to resist and get a grade 5. Manual muscle test rectus abdominis. The origin of the rectus abdominis is the pubic crest and pubic symphysis. The insertion is the xiphoid process in the cartilage of ribs 5 through 7. The action is trunk flexion occurring in the sagittal plane across the mediolateral axis. In order to test for rectus abdominis muscle strength, have the partner lie supine as demonstrated. They are going to curl up with their arms or their hands clasped behind their head and curling up. If she is able to get the entire scapula off the table, which she is not here, that would be a grade 5. The next, a grade 4, is going to be cross the arms across the chest and lift up. She is able to get the entire scapula off the table, so she would get a grade 4. If she was not able to do that, a grade 3 would be with the arms straight and the scapula all the way off. She is given a grade 4. Range of motion, shoulder abduction. The shoulder abduction is performed by the deltoid and the supraspinatus in the frontal plane across the anteroposterior axis. The axis of rotation is going to be the anterior acromion. The stationary arm is going to be parallel to the thorax, and the mobile arm is going to be along the midline of the humerus. Have the partner lying supine with their shoulder or their arm next to their side, and have them perform full shoulder abduction. She was able to perform 178 degrees of shoulder abduction, with normal being 180 degrees. Range of motion, great toe extension. The extensor hallucis longus performs great toe extension in the sagittal plane across the mediolateral axis. Have the partner sitting on the mat table with their ankle and foot hanging off the mat table. The axis is going to be the first MTP joint, and the stationary arm is going to be along the first metatarsal. The mobile arm is going to be the proximal phalanx. She is starting at 160 degrees, going into extension, and ending at 120 degrees, meaning that she performed 40 degrees of great toe extension. Normal is 70 to 90. Cervical extension with the inclinometer. The splenius capitis and splenius cervicis perform cervical extension in the sagittal plane across the mediolateral axis. Using 2 inclinometers, placing one at the spine of the scapula and zeroing it out. Placing the other on the top of the head, also zeroing this out. She is going to perform cervical extension. The one on the head went to 80 degrees, and the one at the spine stayed the same, so she performed 80 degrees of cervical extension. Normal is 60 degrees.